Thank you, I think. I don't know. Look, it's great to be with you and talking about these issues that are affecting our lives every day here. So we all know that the impacts of these closings have been devastating to our communities. And I hate to sound like a broken record all the time, but our focus remains, the county's focus. The Commissioner Maxwell's here, Commissioner Kickline and I are working almost every day on this issue, trying to find prospective buyers. But we have to remember that Tower is a private entity. It is a for-profit hospital. And at the end of the day, we can't tell them who to sell to or who not to sell to. We can't tell them that we have an excellent potential buyer and they have to take it. We can't do that. So we all play this kind of game, right, where we talk to people all the time, good, solid people, local community hospitals, far away places, I mean, anything we can do. But at the end of the day, it's Tower that has to make that ultimate decision. I do think, however, that we are getting close to a kind of time crunch in the process, because within 1 year of the closing, if Tower doesn't sell to another hospital, that hospital cannot use Tower's license. So they would have to start all over again. And I think that's a major, major stumbling block. And I think it's a positive thing for us because that window is closing. And so there are some really good people interested in it, people who will care about this community. And but again, it is a for-profit. It is not owned by the county or the state, and it's not a nonprofit. So it's very hard. Even, Bill was talking about the legislation, but again, you can only do so much to a for-profit. I would just add, because I didn't hear you say that, one of the important things for us is that we have to have more notice than 90 days, and I think that is in that bill, but I'm not sure, because 90 days is not enough for a county to do anything. It's just not. By the time you find out, you're scrambling. In fact, I was having lunch with Vanessa the day we found out, which was just ironic. I'm sure you know what that lunch led to. But it was a scary time, and it is a scary time, and we have to do whatever we can do to make sure that we have health services for this community. And for Josh, who's here, and me, I mean, we represent 500 and close to 40,000 people in this county. And when we talk about Tower and we talk about Brandywine and Jennersville, we also are keeping a close eye on Pottstown and Phoenixville that just got a decline in their rating to a D, because all these hospitals are in our county. So let's see, what else do you have? Partnerships. I love partnerships. Partnerships are a really important factor of life for me. And while it's true that there's so much angst right now with all these hospitals, look what's happened on the good side. This community has come together under the leadership of Vanessa, and our legislators have come together, our schools and community have come together on behavioral health. So it's really a moment in time where we can sit back and look carefully at the needs of this community and other communities. We have Jennersville as well right now, and talk about where we go with mental health, where we go with medical needs. Do we need a full-service hospital here? I'm not sure. Hospitals are changing the way they do business, and we have to, whoever comes in is going to have to think creatively about what makes sense. There's a payer mix, there's all kinds of issues that come into play. And so I think the nature of hospitals across the country is starting to change, and I'm sure Jean knows more about that than I do. But from the moment news of Tower's closing came to be, we had Representative Lawrence, Representative Dan Williams, Senator Comita, Senator Muth, myself, the Commissioners Maxwell and Kickline, and our staff. We all went into high gear trying to figure this out. And that's a partnership right there, right? So I want you to feel good knowing that everybody is working on this every day. You may not hear about it and you may not see it, but everybody is doing it, all the groups out there. Vanessa is looking more closely at the Coatesville area and the surrounding area right here, but there are also obviously the issues in the southern part of the county. as well. Let's see, there's so much going on. One of the things that has really been devastated was the emergency management, the hospitals, the ambulance providers, all of those things, the wait times at the hospitals. But we, with our emergency service center, we put the EMS council together with the fire chiefs and the police chiefs, and they are working, and they're doing such an amazing job getting people where they need to be. A lot of people in Jennersville are going to Christiana Care, Delaware. And then when you talk about the Brandywine, people that would normally go to Brandywine, they are going to Chester County Hospital, and some to Mainline Health, Paoli Hospital as well, and I guess Riddle. There are wait times, there's no doubt about it, and travel times on an ambulance is longer, but our emergency responders are working so very hard to make sure that you are safe and they're getting you where they need to be. We've started, I don't know whether you've seen it, we started a web page dedicated to resources for hospital needs. If you need a hospital, maybe you need an urgent care instead. So we've laid that all out on www.chesco.org/hospitals. I think you'll find that very helpful. And I know that Jean and Pat and Harry Moore are going to be giving specific information on the Health Department, Human Services and Emergency Services to address those gaps. Now we do have the drug and alcohol services and our mental health needs, because with the closing of Brandywine, we lost 64 beds, which is, that's what we had in the county, and it wasn't enough to begin with. So there are some things happening. Mainline Health put 20 beds in the Bryn Mawr facility. It's a little far, but it's 20 beds that we're all kind of fighting for right now, I think, all the counties. And Chester County Hospital is working on a partnership with Haven, which is Haven Behavioral Health, to add some more services for mental health and inpatient. So hopefully that will get going soon. I think they're starting to work on the building, but it's going to take a little time. It's still not going to be enough, but it is a start in the right direction. And I think that the next thing I would mention is for the mental health. The other issue we're finding, part of it is from COVID, part of it is just life, I think, even before COVID, is the issue with our students in our schools and the impact that all this has had on them. So on top of not having things like Brandywine Mental Health Facility, we have a lot of children that need services. And so Representative Sappy has put together a very large task force of legislators, our commissioners, the CCIU, county staff, and others who are just working on ways to deal with students' mental health. So that's a really important thing that's going on you should know about. The superintendents have really tried as hard as they can, but they need help, and we have to make sure that they have it. So I think that's, I think I've responded to all your questions, Vanessa, I don't know. But I appreciate being here. I think this is an important discussion. And I'll turn it back to you.
Great. Thank you, Commissioner.